private sector, from government, civil society organizations, to the Scaling Up Nutrition meeting with a special interest in the Sun Business Network in Zimbabwe. So just a brief background about Scaling Up Nutrition. Scaling Up Nutrition is a global movement that aims to end malnutrition in all its various forms, be it undernutrition, be it overnutrition, be it micronutrient deficiencies affecting our population. So we are bringing together different players from the academia, from the civil society, from the business, from the donor, and from the United Nations, all coming together to end all forms of malnutrition. So each network has a different strength, and together, in a multi-sectorial way, we can end malnutrition in all its forms. So Zimbabwe joined the Scaling Up Nutrition in 2011, and we are one of the pace setters globally, and we've managed to formulate different networks, and there are different levels of functionality. Number one, we have the Civil Society Network for Scaling Up Nutrition Alliance, Cisco-SUNA, which is made up of non-governmental organizations, the civil society, which are aimed at addressing food and nutrition security challenges the country is facing. We also have a network around the donor network. This is made up of various donors in the country that are playing a critical role in mobilizing resources to fund towards addressing food and nutrition challenges we are facing as a country. Another Sun network is the United Nations Network for Nutrition. This network is it is made up of the UN, UNICEF, WFP, World Health Organization. We also have FAO, Food and Agriculture Organization, and other UN colleagues who have a role to play in improving nutritional status of children, mothers, and the general population. We also have the SUNRAP. We call it the SUNRAP in Zimbabwe, the Scaling Up Nutrition Research and Academia Platform. This platform is made up of universities, tertiary institutions, researchers, be it in their personal capacity or as institutions, who try to bring the research agenda on food and nutrition security issues in the country, to provide the evidence base for us to be able to ensure we have informed evidence programming in the country. We also have the main theme for the day, the business network. We resuscitated it in 2019, and we are still mobilizing around having more members and engage more with the private players in how they can address food and nutrition security challenges in the country. We know we have a critical role to address these challenges. I'm just saying these challenges because I don't want to preempt the presentations that are before us. So having said this, ladies and gentlemen, allow me to hand you over to the facilitator for the day, Mr. Raymond Chikomba. He's from the UN network under REACH. REACH is a global movement that is aimed at also ending malnutrition in all its forms. He's like a facilitator around the UN networks, trying to bring together and maybe ensure all players have the same cause in addressing the challenges we are facing. So over to you, Mr. Raymond. Thank you.
Good morning, everyone, and thank you, Madam Sibo. Once again, thank you so much for the strong background that you presented, Madam Sibo. And I think it has managed to shed light on why we are here. And I think even for those who are not aware of what SBN is, I'm sure we now have a context of where we actually are coming from and where we are going. My role really is simple, And I want you to be free to listen, to learn, and to also engage. Let's try to reflect when we are having the presentation and even the panel discussion that we are going to be having. And let's really try to go deeper into this issue of food fortification and try to see how industry can actually be strengthened, maybe to actually participate and enhance the nutrition outcome for our country. So without further ado, I will call upon our speakers, but I will try to be very strict on time, because I think we are about 20 minutes after the time that we're actually supposed to be starting. So I call upon our Sun focal point, who is going to be represented by Tatenda from FNC. Dr. Kembo is our Sun focal point, but he has sent his apologies. So I call upon Tatenda to come and present on behalf of Dr. Kembo. Thank you.
Good morning, everyone. My name is Tatenda Budiwa. I'm part of the Food and Nutrition Council, as Raymond mentioned, and I'll be standing in for Dr. Kembo as the Sun focal point. Allow me to say all protocol observed. I recognize senior government officials here present, our development partners, private sectors, members of our media fraternity, and I understand we also have other people watching online. Ladies and gentlemen, it is my humble and distinguished honor to stand before you today as we bring the various Scaling Up Nutrition Movement members in the country and beyond to discuss topical food and nutrition security issues affecting our general population. I would like to acknowledge and bring to your attention that the government of Zimbabwe has recognized that food and nutrition are indisputable important and illustrated in our key policy frameworks, such as the National Development Strategy that the government has developed. The overarching goal of this strategy is to ensure that we've got high, accelerated, and inclusive sustainable economic growth, as well as socio-economic transformation and development as we move towards what we continue hearing our government talking about, which is the upper middle income society by 2030. So one of the priority areas of the National Development Strategy is food and nutrition security. So directly quoting from the NDS-1, it will prioritize public health measures that safeguard proper absorption and utilization of essential nutrients, which obviously are essential in growth and development, and also in the development of our nation. During the strategy period that is 2020 to 2025, the government will promote consumption of safe, toxin-free, nutritious foods appropriate for dietary needs, recognizing different needs according to gender, according to age, according to different physical activity, and of course, we maintain our socio-cultural preferences. Further, the government will strengthen food and nutrition awareness on diet diversification with a variety of grains that are important in our diets, our fruits, vegetables, etc. This will also involve promotion of exclusive breastfeeding when it comes to our children up to 5 years, and of course, commercial production of nutrient-rich foods, which of course is relevant to us today as we are gathered here to discuss about fortification. Also, the NDS recognizes that upscaling food fortification to supplement with nutrients, and of course biofortification as well, targeting our rural areas with restricted access to markets to fortified or diverse foods will also be prioritized. So we're also saying in the NDS we've got multi-sectoral committees that we work with at national and sub-national levels, which also need to be strengthened
for us to support the implementation of the different strategies that the government has put in place. So these commitments by the government express a shared vision and commitment for improving the quality of life. I think we can all agree that it's important for us to have a quality of life so that we are productive and that we have a prosperous economy. We can achieve this through accelerated action to improve both national and household food and nutrition security. We can also achieve this by improving the quality of the diets that households are consuming at the different age groups as mentioned, and ensure food safety, improve nutrition for our adolescents, for our pregnant women, our young children, and also reduce stunting in our children. So as a country, we also face the burden that we call the triple burden of malnutrition, which has come into play because of coexistence of both undernutrition, which is characterized by stunting and wasting, micronutrient deficiencies, and also upcoming challenges of overweight and obesity, which have been a challenge in recent years, coupled with our global COVID-19 pandemic. So the COVID-19 outbreak is also likely to roll back the years of progress that we've made as a country, as we see that malnutrition is accelerated by the impacts of COVID-19. And also where undernutrition compromises the body's immunity, we also see that interchange between COVID-19 and malnutrition. So the crushing impact of micronutrient malnutrition on survival, growth, health, intelligence, as we are talking about adolescents and school children, it also affects their intelligence and productivity as a nation. So worldwide, we have seen that billions of people are prevented from achieving their full potential as students, as parents, as workers in the different workforces, as citizens due to micronutrient deficiencies. So these circumstances brought forth the need to come up with multi-sectoral interventions, the different sectors coming together, the business sector is we are gathered here today, the government, development partners, etc., to which food fortification is one intervention that is bringing together the different stakeholders. So as a country, we have long recognized the need for a multi-sectoral response to food and nutrition insecurity. Hence, you see the Food and Nutrition Council bringing together the different stakeholders, recognizing that we need to come together, and that leaving the responsibility to only one sector alone is not enough to address this persistent problem. So all players in the private and public sector are aware of the opportunities of delivering integrated services within their own sector. And other sectors, thus, their involvement reinforces that there is need for broader-based multi-sectoral approach to enhancing both food and nutrition security. So as a nation, we recognize that we cannot address food security alone, we cannot address nutrition security alone, but we have to address both food and nutrition security as they are interlinked. So there's a need for transformation at the household level, which requires trust and close collaboration in country between the different SUN actors and the different networks. I think my colleague mentioned the various networks that we are working with in terms of scaling up nutrition. So as SUN country stakeholders, we should engage more the business sector to improve healthier choices at the household level and merchandising practices to increase consumption of healthy foods by consumers. So investing in nutrition is one of the best means we have to transform health, to transform education, and also to transform the livelihoods of our nation. So this meeting has come at a very pertinent and important time, and is one of the first subsequent annual business indabas. We hope that this will become an annual event where we meet and discuss issues that are affecting our business sector. So with this meeting also brings together the opportunity for industry players, the government, development partners to interact and harmonize our efforts in terms of scaling up nutrition. So we need to support the Sun Business Network, as mentioned, and its strategic mandate, which elevates the government's aspirations to alleviate hunger and malnutrition. So I'll conclude by mentioning the objectives of this meeting, which are, first of all, to initiate the Sun Business Forum to the role of business in supporting food and nutrition security, to improve the efficiency and effectiveness of government investment on food security and nutrition by highlighting the gaps that are existing, the opportunities that are around us, and also the impact of the current fortification initiatives that our country has put forward. So our aim also today is we hope to raise awareness and promote food fortification to improve knowledge and appreciation of fortified foods and their associated benefits. Allow me to conclude by saying that nutrition is key in achieving our sustainable development goals as a country. Attainment of an upper middle income economy, which is our aspiration as government by 2030, and it also plays a transformational role in boosting our country's economic development. So let us all be free to engage in the discussions and shape the Sun Business Network role in improving food and nutrition security in Zimbabwe. And also let me conclude by saying I am welcoming all of us to this very important indaba, and we hope to engage, to inspire, and also to accelerate nutrition efforts towards our nutrition. Thank you very much.
Thank you, Madam. Thank you so much, Tatenda. Thank you for that powerful delivery. I'm sure we all got the key issues that she raised, which pertain to the fact that this exercise, especially for, the exercise of fortification, is actually included in our NDS document. So government has actually prioritized it. And the key issue that we are actually raising, especially with business, is let's invest in nutrition. Thank you so much for those key points. And without further ado, I would want to identify our next speaker on the program, the Sun Business Network Chair or President. I call upon Madame Mercy Chachkoka to lead us in the discussion of introducing what SBN is all about in Zimbabwe. Thank you.
Good morning, ladies and gentlemen. It is my pleasure to stand before you as the Sun Business Network Chairperson. And my role is quite simple. It's to introduce what Sun Business Network is for the benefit of new members that have joined us, and to maybe synthesize to the already existing members on the mandates and the goals that we have as a network in Zimbabwe and beyond. Next slide. By way of introduction, Sun Business Network is a platform for private sector engagement. So why we emphasize on private sector is because of the extensive expertise that is present and prevalent in businesses, private businesses, that can be applied for solutions to improved nutrition. And we do this because we know that there's no much bureaucracy in businesses And the aim for most businesses and their existence is to make profit. But because of that, we have so many enabling factors that allow us to work with businesses, because they are the ones that provide food to the rest of the urban population as well as even the rural population. So our enabling factors are the leveraging that we have on existing Sun business networks in the region. We have a vibrant network in Malawi and Zambia that we need to benchmark on and draw lessons from so that we can improve as a network. We are a private sector-led network with a private sector orientation and modus operandi. So we operate based on private sector orientation. And we believe that nutrition offers opportunities to increase sales and profits that contribute to both social and economic developments, as most businesses exist to raise profits and to make sales. And by so doing, we hope that the Sun Business Network will be an arm that operationalizes food and nutrition policies by being very well involved. As previous speakers have said, scaling up nutrition business network in Zimbabwe was formulated in, well, Zimbabwe joined the Sun movement in 2010, and then in 2011, sorry, and then the Sun Business Network was actually resuscitated for operations in November 2019, and we have over 20 private sector organizations as affiliated members, and we hope to grow these membership, hence why we are having this Indaba as an annual event, and hope to do more activities to increase our visibility and our participation. And this is a platform for engagement for businesses with a multi-sector approach and with a countrywide and country-owned solutions to scaling up nutrition. And the aim of this network basically is to reduce malnutrition in all its forms through mobilizing businesses to invest and innovate in responsible and sustainable actions and operations that allow for improved consumption of nutritious and safe food for all people. And we also hope to harness the expertise that is prevalent in private sector, reach and market impact of private sector to improve nutrition to consumers, as well as to improve and promote food safety and food and nutrition security at household and nutrition and national level. Next slide. Next slide. We prioritize businesses and private sector because we believe that in the food and agriculture sector, there is a net annual investment of about 320 billion by the private sector that could result in business opportunities across the food system, which will total about $2.3 trillion by the year 2030 in areas of food production, all the way to processing and sales. Hence, meaning that there is a lot of opportunity in investing in nutrition in the private sector. This is the journey that we've taken so far as the Sun Business Network in Zimbabwe since inception. We are coming from a position where we've just been involved in key policy and strategic discussions, involvement by participation. So all the multi-sectorial consultation strategies that Tatenda and the previous speakers have spoken about, we as a network were also present in most of the discussions in coming up with those strategies and policies. And we have also been filling the gaps by being major participators in the National Food Fortification Program since its inception. But to say the least is to emphasize on the point that only maybe larger organizations were very supportive in this mandate of the National Fortification Program, and we need more SMEs to come in on board on this one. And we also believe that we need to grow our membership and our visibility through participation. We haven't really done much. Yes, COVID has been present since our inception, but we also haven't done due diligence to what we need to do as an arm that leverage on participation and awareness of nutrition and curbing malnutrition in all its forms to the consumers as well as to the market offerings that we put on the market. So we believe that we have a role to play by putting product offerings and running awareness campaigns in the market to promote nutritious and safe food for all. And we hope to be moving towards a point where we promote diverse and sustainable food systems. And we believe that SMEs, you have a center stage to play in this. Large organizations have by and large been supportive of most of the Food and Nutrition Council policies, government policies to promote nutrition. And SMEs, because you lack so many, you don't have too much bureaucracies in putting together your solutions on the market, we believe this is your time to take the center stage. And also because 64% of the African food consumed on the African continent is handled by millions and millions of SMEs. So SMEs have a higher chance of participation in promoting nutrition. And we hope for a greater and a better future where we are moving towards a food and nutrition secure Zimbabwe, where there is no micronutrient deficiency, where there is no malnutrition or overnutrition, and that will be a thing of the past. So the key focus areas that we believe are where we need to participate and act on as SAN business in Zimbabwe is the promotion of food and nutrition security. We believe that we can work and be able to play a pivotal role in improving the food value chain supply by being present and playing at each and every stage of the value chain. And innovation is a key factor in improving nutrition in Zimbabwe. And we cannot hold back technology as we cannot hold back the wind. And by so doing, we believe businesses have a higher chances of adopting technologies across the value chain, be it from improved cold chains, agriculture by adopting agri-tech and e-agriculture, climate smart agriculture, and smart and sustainable processing technologies in the business world. We also believe that there is a huge investment that needs to be done in the nutrition space. And this can be done by making business propositions for investment in the nutrition space, ideal for impact investors. And this is where we are calling upon most of the SMEs to come in on board. We believe we also play a central role in promotion of fortification and biofortification by bringing in cost-effective fortification solutions for staple foods and condiments at scale, and also biofortification at household levels in rural communities. We need to support nutrition-sensitive interventions by riding on existing platforms like our mobile operators, maybe in running campaigns with, when COVID came through, so many businesses jumped on that platform and they were sending in awareness campaigns on how we can curb COVID-19 spreading and preventive measures by using such platforms. We can do the same in promoting nutrition by using the same. Public and private sector partnerships are very key as well in promoting this. I think the previous speaker overemphasized the need for a multi-sectorial approach in curbing malnutrition. So we believe that we can explore partnerships through the government and NGOs for special formulated foods and food that is for targeted vulnerable groups. We can promote workplace nutrition by introducing nutrition and wellness programs for our employees to make healthy choices and healthy lifestyles, as well as providing breastfeeding rooms. By so doing, we can promote nutrition, because a healthy and a nutritious workforce is a healthy nation. Generate demand for nutritious food. We believe that in Zimbabwe, we are content with just having food on the market. Whether it's nutritious, whether it's safe, maybe it's a thing of the, tomorrow. And that's where we need to drive it now. And we believe that we as the business, we can drive that mandate. This is just a slide that is emphasizing on the rationale of which sectors as a business, all the businesses can fill in and close the gaps in promotion of nutrition and curbing malnutrition in all its forms. So for the industry group, the left side is the industry group, and the right side is the rationale for why you need to be a SAN business member and what your role needs to be when you are part of this network. So for food production and processing, basically we are advocating for improved regulatory environment, for improved food safety and ease of doing business. We also believe we are the ones that can raise the awareness and generate demand for nutritious foods on the market, as well as understanding broadening our understanding for the market and the consumer needs. Then by becoming consumer-centric in terms of nutrition and safe food. For agriculture, we believe that if we adopt the global gap, good agricultural practices, we can then promote food safety. And by so doing, we can improve the food security and the nutrition security of our nation. We can also adopt technologies to improve food supply. Retailers have a major role to play by demanding and promoting nutritious food as well on the market. We spoke of investments, and we need banks and institutions to come on board. So businesses need to do pitch competitions and to make sure that SMEs write business propositions for nutritious and safe foods that attract impact investors. Distribution of food is also key and vital in reducing the cost of nutritious food on the market. So I believe every business and every business industry group has a role to play in promoting nutrition in the business space. Next slide. I will conclude by putting to you what we need to do as our next step as a network. We really need to put together a strategy, because I believe that if we have a plan that we put together and we follow that plan, we can always be able to achieve our objectives and our goals. And we will start, I propose that we start by regional benchmarks, learning from the likes of Zambia, the likes of Malawi, because they have vibrant networks that are doing amazing things in the region. So that's where we need to start from. And then we draw our draft strategy and then start implementing on what we need to be achieving for maybe the next 4 years, since I've proposed a 4-year strategy, and then piggybacking with what the national government already has, the national development strategy and all the other key governmental strategies that are in place that are also promoting nutrition. That's what we need to do, and this is where we feel we really need to do our part as businesses and to come on board, together with the other networks that are already at higher levels of operations. We believe that with their support, we can grow as a network. Thank you.
Thank you so much, Messi. And I think he has managed to really capture the attention of the business community, especially the SMEs. I think their role has to be strengthened. And I think the big question that we have is to say, how do we engage the SMEs? How do we grow the membership of the SBL? And I think it's good that she also mentioned that we have countries that we can learn from. We have Zambia and we also have Malawi, who are maybe at a more advanced stage than Zimbabwe. And we could always leverage on such regional partners or countries to actually learn more and grow our network, as well as engage the various domains of business who are quite critical in promoting nutrition for Zimbabwe. So yeah, without further ado, I would want us to follow our program and introduce the next speaker, who's going to talk on the state of food and nutrition situation in Zimbabwe. I'm going to introduce the Deputy Director at FNC, Madam Yvonne Mavunga, to lead this presentation. Thank you.
Thank you, Raymond, for offering such an opportunity to speak to you people in terms of what is the state of food and nutrition security in Zimbabwe. So in terms of the context, food security, the food security situation in Zimbabwe remains fragile. So the large segment of the rural population relies on government-run or donor-based. So the country's food import bill is high and unsustainable against the background of fiscal constraints and foreign currency shortages. The input schemes combined with grain producer price schemes So the food and nutrition security situation in Zimbabwe remains fragile. A large segment of the rural population relies on government-run or donor-based seasonal food and non-food safety interventions for their food and nutrition security. The country's food import bill is high and unsustainable against a background of fiscal constraints and foreign currency shortages. The input support schemes combined with grain producer price support schemes and direct subsidized sales to large-scale millers and promoting food production and ensure lower price consumption prices have not only had mixed results on food production, but have added to the fiscal challenges in the negative budgetary implication. Food safety threats which exist through imports, pests and diseases are exacerbated by limited institutional capacities for testing food safety. Households are faced with deteriorating purchasing power amidst rising prices of basic commodities such as bread, cooking oil, and fuel. In addition, the country is facing a triple burden of malnutrition. So there's undernutrition, overnutrition, and micronutrient deficiency. Next slide. So malnutrition continues to be a major public health and socioeconomic problem in Zimbabwe.
affecting mostly children under 5 years and women of childbearing age. Malnutrition in all its forms includes undernutrition, wasting, stunting, and underweight, and inadequate vitamins or minerals, overweight, obesity, and resulting in diet-related non-communicable disease. To address these global nutrition challenges and recognizing that accelerated global action is needed to reduce persistent and vicious problems of the malnutrition, in 2012, the World Health Assembly resoluted that 56.6 recommendation, a comprehensive implementation plan on maternal, infant, and young child nutrition, which looks at the following targets. Achieve 40% reduction in the number of children under 5 who are stunted, 50% reduction in anemia, 30% reduction in low birth weight, ensure there is no increase in childhood overweight, increase the rate of exclusive breastfeeding in the first 6 months to at least 50%, and reduce and maintain childhood wasting to less than 5%. So we'll go into the data. Next slide. So if we're looking at the slide, this is an example in terms of just illustrating what is stunting. So these children, this cartoon just shows children of the same age, but the child with the green short is short for their age. So that's stunting. So the child in the green short is stunting and is underweight. But the child in the red short has no stunting, has no wasting, and there's no underweight. So stunting is one of the most significant impediments to human development. And stunting, you are too short for one's age. It's largely irreversible, an outcome due to inadequate nutrition and repeated bouts of infection during the first 1,000 days. So in terms of some of the effects, these include reduced cognitive and physical development, diminished productive capacity and poor health, and increased risk of degenerative diseases such as diabetes and hypertension. According to World Bank, a 1% loss in adult height due to childhood stunting is associated with 1.4 loss in economic productivity. It is estimated that stunted children earn 20% less as adults compared to the non-stunted individuals. Next slide. So in terms of the nutrition trends, we can see since 2012, our exclusive breastfeeding gained, and it went down.
Trading because they want to bring a separate
according to our global targets, we need to at least reach 50% of our children being exclusively breastfed. Our main problem also is stunting, which is reducing on a very slow pace. In 2012, it was at about 26%, and it's going down steadily to about 23.5%. The rate of decrease is very slow, and we foresee if there are no major changes, one meet the global targets in 2025. Then in terms of underweight, wasting, and overweight, they've all remained below 3%. Acute malnutrition is an indicator of current nutritional status, reflects weight and disruptions in nutrition indicators, and is classified as either moderate or severe malnutrition. And this can be seen as marasmus or kwashiorkor. So I'll speak to severe acute malnutrition, which is marasmus, which is seen by severe weight loss, a wizened look, prominent ribs, apathy, and irritability and poor appetite. Then we have got acute malnutrition, kwashiorkor, which shows bilateral pitting, dermatitis, thin skin, thin and silky skin, and apathy and irritability. So these children actually have kwashiorkor. So these are signs of acute malnutrition. Then in terms of management of acute malnutrition, the health information system, we recorded a cure rate of 68%, which is far below our cure rate according to the sphere standards. So more it needs to be done in terms of how we are dealing with acute malnutrition issues in Zimbabwe. Our defaulter rate was 17%, that is in 2019, which is higher than the sphere standard of 15%. And our death rate was at 3%, which is lower, which was within the sphere standards. So we need to improve in terms of management of acute malnutrition. Then we go on to low birth weight, which has been around 9%, so meaning almost 1 in 10 children born in Zimbabwe are born with a low birth weight. That's a very big challenge in terms of the development of those children. Next slide. In terms of micronutrient deficiency, we have got 25, according to the micronutrient survey of 2012, 29% of our children 6 to 59 months have vitamin A deficiency. In women is 24%, iron deficiency in children is 72%, iron deficiency in women is 62%. You can see the magnitude of these problems. Next slide. It's also visible in terms of the consumption patterns within the country. So this is according to a study which was done this year, a rural livelihoods assessment. And we're actually seeing an increase in poor consumption and a deterioration in acceptable and borderline diets. So this is a cause of concern. Even if you look in the next slide, we are breaking down in terms of what is consumed daily by households. And you see that most households are consuming vegetable, oils, and cereals. And this is at household level in the rural areas. And it's actually showing a deteriorating picture. Next slide. So in terms of household consumption of protein, iron, and vitamin A-rich foods, not all households are actually consuming these foods. So we see there's a very big gap, especially in terms of iron-rich foods. As we move on to look at micronutrient deficiencies, we've got anemia, we've got vitamin A, which is mostly affects growth retardation and also affects night blindness. Iodine, we have got abnormal growth and development, and the prolonged deficiency causes goiter. Calcium and vitamin D, we have poor bone density, and which leads to skeletal deformations. And then in terms of zinc, it leads to impaired growth and development and a weakened immune system. As you can see, zinc and vitamin A are also important. Also looking at the current pandemic, was if our immune system is compromised, it means we'll have difficult challenges in terms of dealing with the current pandemic. Then we're looking to the food security side, in terms of crop production. As you can see, crop production has been so irregular since years back. And I think maize is the mostly produced crop. The other crops such as seed cotton, which is our source of oil, and groundnuts, the production is very low. Next slide. So if we look at production versus requirements, we've seen the green bars are always below the requirements. So there's lots of investments which needs to be done in the agriculture sector so that we start meeting our food needs. So it's only in 2021 that we actually surpassed surpassed our cereal requirements in terms of national requirements. So in terms of food security in trends, we see a growing need of people needing support in terms of food supply at household level. Then we look at livestock production, which is the last slide. This is also one of the sources of iron, and we see production, especially of small stock, that sheep and pig are very low. And the most kept crop is cattle. And knowing our tradition as Zimbabwe, livestock is more of our security and insurance at household level. A beast is only slaughtered when there's a very big ceremony at a household. So this are some of the information I wanted to share with you in terms of our food and nutrition security issues and the problems we are facing as a nation in terms of food and nutrition security. Thank you all for paying attention.
Thank you, Madam. Thank you for, is that music for me? Okay. Thank you, Madam, for highlighting those technical issues with regards to nutrition. I think even though today we're focusing on fortification, I'm sure as business people we've also seen the challenge of acute malnutrition, kwashiorkor, marasmus. We've seen those children who have edema, with legs that are swollen. I think we can also ask ourselves again, as business people, treatment of severe acute malnutrition. Maybe it's an endeavor for another year, but I think we also have to see the bigger picture and also capture the other roles that we can also be playing. We are a bit behind time, but I think we'll manage. I'll call upon our next speaker, Dr. Leslie Macheka, who is the president of the SANDRAP, our SAN Academia platform. Dr. Macheka, the time is yours. Thank you.
Just actually move this.
Thank you very much, Raymond, for the introduction. Like introduced already, my name is Leslie Macheka. I'm representing SANREP. I'll go straight into my presentation. So this is the outline of my presentation. I'll take you through the background, journey towards addressing malnutrition in Zimbabwe, food fortification, what is it, then evidence on impact of food fortification at the global level, then I'll come to Zimbabwe. So Yvonne has already done some part on the background of food and nutrition security in Zimbabwe, which is also part of my background. So nutritionally, adequate diets continue to be threatened in many ways. I think we all know about issues of climate change, high frequency of droughts in Zimbabwe and globally. So all this is contributing also to malnutrition, food systems that do not contain nutritious foods, limited purchasing power of individuals and also families, limited access to nutritious foods, and markets also. So all these results in a lot of challenges in terms of nutrition security. That's deficiencies in vitamins and minerals such as iron, folic acid, zinc, etc. Now I'm taking you through the journey in addressing malnutrition in Zimbabwe. So these are various activities that have taken place since 1980 to 2018. So now we are around at 2016 where food fortification was adopted or introduced in Zimbabwe. So a lot of things activities have happened. A lot of intervention strategies have taken place or have been implemented before. So food fortification, I think that's why we are here. What is it? So we are talking about the industrial food fortification so I've chosen a very simple definition. So we're talking about adding micronutrients and minerals to industrially processed and widely consumed edible foods. So it's not only every other food that is fortified, but you look at the most commonly consumed by the population. So this is a cost-effective and sustainable strategy to improve nutrition health status of a population. It is important and complement other nutrition-specific and nutrition-sensitive interventions. There are several interventions. Remember, there's no silver bullet to malnutrition challenges. So this is one of them, and also they complement each other. So at global level, there's strong evidence of that fortification has led to significant positive impacts on nutrition status. From this article, they reviewed several other scientific publications on the evidence of the impact of fortification on nutrition status. So I'll just go through, pick the major results, which they are saying there's evidence that large-scale food fortification programs were associated with at least 34% reduction in anemia. So from improved iron stores, then 74% reduction in odds of goiter due to increased iodine intake. So at global level, that's the evidence we have. Then coming closer to home now, coming to Zimbabwe now. So in June 2017, the government of Zimbabwe made it mandatory for major food manufacturers to fortify processed staple foods with micronutrients. And talking about edible vegetable oil, wheat flour, maize flour, sugar, salt, which are commercially produced. So it's a mandatory regulation. That's the Food and Food Standards Regulation 2016. That's you can read it. So that's what it's contained in the standard. Said oil, maize meal, your flour, your salt, sugar, and wheat flour. Then do we have any evidence or any research that is going on in Zimbabwe regarding food fortification? Yes, it has been made mandatory, but is it effective, or do we have any evidence on its implementation in Zimbabwe? Unfortunately, I think coming from research in academia, for me, this is not a good story that we lack evidence due to limited scientific studies. I think when I researched, and I also called some other colleagues who are in academia and research asking that, no, I only managed to find 2 articles, studies that have been done on fortification. So these are the 2. So you find this is more talking about the potential food fortification. This one now, at least it's a bit closer, talking about the impact of food fortification on stunting in Zimbabwe. Maybe there might be other studies that have been done, but not publicized. So I think once you have done your study and it's not publicized, it's not on public domain, then the information is very difficult for us to extract it. So I'll dive into the results of this study. The study was based on the 2018 National Nutrition Survey, whereby about 25,000 households in Zimbabwe, rural and urban, were surveyed. So 25,294 households were surveyed. from the findings, is only 3,038 households knew about fortified foods. That's only 12% of the surveyed population. That's very low. So already knowledge about food fortification was very low. That's in 2018. I'm not sure about now, but I doubt if there is much improvement. Maybe it's there, I'm not sure yet. So households that adopted or that buy fortified foods were more educated. So these are background characteristics of the surveyed households. We're more educated than those that report that they don't buy. So roughly, educational knowledge had an effect. Then another finding on background characteristics was that large-sized household with more economically active members adopted fortified foods. Then also, we also did some regression analysis, trying to see the impact of fortification on stunting. So basically, we were basing on households that reported that they consume fortified foods. So households that adopted food fortification had a lower proportion of standard children under 5s. So we're comparing with those that reported that they don't consume or buy fortified foods. So what we are saying is in that what is showing is to some extent adoption of food fortification is correlated with reduction of stunting in children. Yeah, so that's the major finding that I can report from this one study that's available so far.
Yeah. Thank you.
So in concluding, adoption of food fortification is correlated with reduction of stunting. Anyway, I also need to put a disclaimer. However, it is important to control for self-selection bias as we do the regression analysis. Then lastly, adequate information is important for wide acceptance and adoption of food fortification in Zimbabwe. Yes, like we're saying, only about 12% of the surveyed population knew or had knowledge about food fortification, which is very key. For a consumer to make an informed decision to buy something, they need to have knowledge. What is food fortification? What are its advantages? So I think we are lacking on that aspect, on that area. Lastly, maybe also what I should also highlight, especially from the limited studies that have been done, I think there is really need to do more research on this area of food fortification, because even for policymakers, they need evidence. Does it really work? So far, since 2016, when it was made mandatory, what has been the impact on food and nutrition security? Are there any changes? I think maybe since the micronutrient survey is almost due, so maybe we will find some evidence when the micronutrient survey is conducted. Maybe I could take this opportunity also to make a plea even to our business community, development partners. Let's also partner. Let's also join hands together to do more research in this aspect of food fortification. Yes, we'd want to do research. Sometimes funding is a limitation. But I think as we agree already, we only have maybe one major scientific evidence or scientific research that has been conducted on this key area of food fortification. I thank you.
Thank you, Dr. Leslie. And I think he raised a very key area, an area of research, which I think as a SUN network, our academia as well as our SBN could work closely in this regard to actually ensure that we have evidence which supports the kinds of interventions that we would want to make. So at this moment, I would like to notify our exhibitors. I don't know if I'm still. Our exhibitors, can you be ready at your stands? Because as we break for tea, people would want to take the opportunity to go around and see your exhibitions. So we are breaking now for about 20 minutes. Let's be back at 10:55. Thank you.
this workshop. At Nestle, as an organization, our purpose is to unlock the power of food, to enhance the quality of life for everyone today, tomorrow, and for future generations to come. We strive to support micronutrient deficiency through fortification of our products. To date, progress has been made, but work is still to be done. We have a set of commitments and achievements that we have committed for us to address the micronutrient deficiencies through fortification of our products. We constantly look at our portfolio and ensure that we target most of the products that we make as Nestle to address these issues that we have in our society. We have looked at our portfolios in different ways to find the volume drivers in which we can fortify to address the things that we face in our society. For our cereals, we are happy to note that all the cereals that we produce at our Harare factory, they are fortified. And for that portfolio, one of the brand is Nestle Cerevita that we have on display today. Nestle Cerevita, we have our mainstream product, which comprises of the corn and wheat, the corn and cocoa, and the corn and banana. And we also have the Cerevita Flex with milk and our recently launched Nestle Cerevita instant sour porridge. All these products are fortified with a formulation that we call Grain Smart, which is a smart combination of vitamins and minerals to fortify cereals. We are also delighted that we went further to the extent of fortifying small packs to ensure that we can have affordable nutrition for all. Thank you.
Suppliers of vitamins and vitamin premixes all over the world. We're a global company. The vitamins themselves are manufactured overseas, so in Europe, in the West and the East. DSM do have a premix plant in South Africa where we put together the individual vitamins according to customer specifications or country specifications, and we supply into sub-Saharan Africa. So the sectors we're busy in are the food sector, the pharmaceutical sector, and the personal care sector. We work closely with our customers to develop premix standards, and we supply whatever our customers need. Thank you very much.
promotion and development of micronutrient-dense crops. We started over in the year 2015. Currently, we are working under the Ministry of Agriculture together with the Ministry of Health in the development of biofortified crops. So, over the years, we have developed different varieties from the 3 crops that we are promoting, which is orange maize. Orange maize here is rich in vitamin A. About 5 varieties have been released in the country, and seed companies have registered and are promoting these seeds. We are also using iron bean, which is the 2 varieties that I have here, CGS mine, and we also have got NUA 45. We have got a lot of seed companies, about 12 of them, that are also multiplying and marketing these iron bean varieties. Recently, we introduced the orange sweet potato. I've got Alicia here, and also another variety, Delvia, over there. So the sweet potato is also rich in vitamin A. Basically, what we are trying to do is to respond to the challenges that the country is facing in terms of micronutrient deficiency, and we do that through the development of the crops and the multiplication of the seeds, so that the raw farmers, those that cannot access the food that are fortified in the shops, can just grow their food and eat, at the same time addressing their micronutrient needs. So this is what we are doing basically. So we are working through a number of partners, including developmental partners, NGOs, government departments, government ministries, as well as the private sector. We are working throughout the value chain, from the development of the seed right up to when the seed gets to the market. So we are working with the seed companies, we are working with the researchers, we are working with the farmers, we are working with the aggregators, processors, and the retail outlets. That's what we are doing as a Harvest Plus in the country. So we have conducted also over the years a number of promotional activities, awareness creation activities, and developed a lot of literature which we distribute to farmers. Currently, when we started, we were just working in about 12 districts of the country in the Midlands, Manicaland, and Mashonaland Central and Mashonaland West. But through these awareness programs, we have now reached out to the entire country, and we hope in a short maybe space of time, almost every household should have access to biofortified seeds so that they can nourish the family. I'm sure maybe with the reach the 2030, biofortification should be something that will be talked about in every household. Thank you.
which is an agency under the Office of the President and Cabinet, tasked with the mandate of promoting a multi-sectoral food and nutrition insecurity response in the country. And today we are showcasing our knowledge products as well as some of our work as a Food and Nutrition Council. To begin with, I will start with our mandate, which is coordination, and through that we create sub-national structures as well as national structures for coordinating food and nutrition, which we call the Food and Nutrition Security Committees, which brings together all the stakeholders in food and nutrition to address the challenges of food and nutrition at their level. And these, we use an approach called the multi-sectoral community-based approach, which capacitates them to identify their problems and address them through traditional leaderships, through identifying interventions that are appropriate for their scope. As part of our drive to inform policy and general evidence for intervention, we do assessments and produce papers. To begin with, we have our annual assessment, which is the livelihoods assessment. And on display today, we have the 2021 Rural Livelihoods Assessment results in English, as well as summarized fact sheets in all the 15 languages, as well as thematic papers that we've done as part of our advocacy to Parliament, as well as policymakers on the impact of COVID on food and nutrition security. And furthermore, we also do work in support of Healthy Harvest, which is promotion of home gardens for people to grow nutritious food at household level. And last but not least, I'll speak on the Sun Business Network, which we are the key coordinator on. And we have forms for companies and private sector who would like to join the network to fill in and live at our stand. And that, in brief, is what we are as Food and Nutrition Council, as both a knowledge hub and an advocacy agency for food and nutrition security in Zimbabwe. Thank you.
Riley. I work for a company called Hutano Foods. What we do at Hutano Foods is we work with indigenous ingredients from farmers. We add value to them to make nutritious, healthy, delicious snacks and ready-to-eat snacks and breakfasts and porridges. So today I have a porridge that is 100% locally grown, made from locally grown ingredients. We've got, this is what it looks like. So this is an instant porridge that's been made with white sorghum, ngimo, ground nuts, and baobab powder. At Hutano Foods, we work with over 300 small-scale producers. So we're looking at your small-scale farmers and we're looking at your wild harvesters. We believe that working with underutilized ingredients can provide the nutritional value, a good, healthy diet for our local consumers. Our products here, for example, the porridge that we have, it's would say its nutritional value is actually more than what is approved than with the Ministry of Health because of the ingredients that are used. We are the only instant product porridge, if you see on the shelves, that actually uses a variety of ingredients. Yeah, that's it. Thank you.
The various networks with their specific action in the country. So the Sun Business Network is mainly made up of private sector players, from large-scale manufacturers to the SMEs, and also to individuals that have got an interest in improving diets for the general population. So the meetings was mainly centered around trying to set the tone around the issue of the the statistics around food and safety challenges we are facing as a country. For example, we heard about the issue of malnutrition, the challenges we are having for stunting, where we are having our children being too short for their age. It goes beyond just being too short. The stunting is out in poor development, poor school performance, and overall as a country, we can incur DGB losses if we don't address stunting challenges. The first session also was looking at the micronutrient deficiencies that we are facing as a country and trying to address. This is to do with vitamin A deficiencies, where we heard that our children and women of childbearing age are affected by vitamin A deficiencies. Also heard about the anemia challenge, where we are facing as a country, where our children and women, even over 20% of our mothers, having anemia. And this shortage or this challenge of anemia goes beyond the issue of even affecting birth outcomes, where children are born with low birth weight as one of the effects. So if we are to address the challenges of malnutrition, we have to address these micronutrient deficiencies. And it starts when the mother is preparing to become pregnant. How are we addressing, how are we providing the nutritious diets? We are looking here at the issue of various forms of fortification. That's what one presenter was talking about. Fortification starts throughout the food system. We talk about fortification at production level. We are talking about biofortification, which include varieties we have as a country, and what are we promoting? The orange maize, the iron-rich, zinc-rich beans. We're also looking at the orange-fleshed sweet potatoes, which are rich in vitamin A. How are we promoting that as a country and as a private sector? And that's our role in trying to address these challenges that we highlighted. We also look at the issue of the industrial fortification, the mandatory fortification around the major food vehicles, our wheat, flour, and maize, and cooking oil, where we are saying we have added these micronutrients into these food vehicles so that those who purchase food on the market, they can access the micronutrients. And also, we are looking at home fortification. We were saying we have those vulnerable children and even mothers who may need to sprinkle the micronutrient powders at home where we are facing these challenges. So it's a mix of interventions, and not one intervention can solve it all. And in the first section, again, we went through the research. What research exists with regards to fortification? And the academia platform chairperson highlighted that we have limited research around food fortification. And we're saying we need evidence-based programming. We need to provide the platform for our stakeholders to be able to make sound decisions based on evidence. And from the study that they did, they were using the ZIMVA data, which is the Zimbabwe Vulnerability Assessment Committee, Rural Livelihood Assessment, which showed a correlation between households that were accessing fortified foods versus reduction in stunting. So we are saying if there is an opportunity for us to address the challenges of malnutrition in the country, why can't the private sector and other players come in and put it together and address these challenges? We also heard that as a country, our pool of studies around the food and the link to health is also limited. Or if it's there, it's not publicized. And we say something not shared is not known. But we are calling to all researchers, all scholars that have studies around food fortification to come forth and provide the evidence base that is required so that policymakers, they make decisions that are evidence-based. And programmers, they come up with interventions informed with this, research. Look at our iodine success story. It started in the 80s, but now minimum cases of goiter we can see on the street. So we are saying we can do that for vitamin A deficiency. We can do that for iron deficiencies. We can do that for zinc deficiencies. So generally, that was the first session. So in the next phase of our meeting, we're going to go into panel discussions where we have got representatives from government who will talk about the policy framework, the policy and legal framework around food fortification in Zimbabwe. We also have someone from the Millers Association trying to talk what they've been doing in supporting the fortification drive. What challenges were they facing or are they facing? And proffer any recommendation to government, development partners, and all players in addressing these challenges. And also we have the bigger voice, our consumers. So we have a representative from the Consumer Council who are going to give us a perspective on food fortification, how the consumer view fortification. Are we involving them? What's the gap? And what do they want us? What do they want from us as government and as the private sector? So we have that section, and we have a very good discussion around that area. So we invite everyone to keep on logged on and continue engaging in this topical discussion. The door is open. Let's reshape food. Let's address malnutrition. No one sector can do it, but together we can achieve this. Thank you.
Thank you. Welcome back, ladies and gentlemen. We are back in our sessions and we are continuing. For this period, we are going to go into a panel discussion, which is going to be moderated by our UNN colleague, who is actually the chair of the UNN network. So I will ask Safinas Ahmed to come and lead this panel discussion. And for those who are posting questions, continue doing that. We will have an opportunity at the end of the panel discussion to actually go through some of the questions that would have been raised. So I call upon Safinas to lead this discussion. Thank you.
Good morning, colleagues. Thank you, Raymond. It's a pleasure to be given the opportunity to moderate this session. My name is Safinas Ahmed. I'm a policy advisor for nutrition for the World Food Program of the United Nations. Nutrition is quite one of our areas that we are quite interested in. And all along, yes, we do provide in-kind assistance to the vulnerable groups, but we've always think that a sustainable way of providing all Zimbabwean with nutritious food is through a bigger engagement of all sectors, and especially the private sector. We have a definite interest in that. I'm personally quite happy to see that the business network for the Sun has been resuscitated. I enjoyed so much their presentations, and I was keen on how they are planning to move ahead. A personal request, moving ahead, I would like if they kept us in the WFP, not only WFP, but the UN Nutrition Network involved. Without taking so much time, it's my honor to be introducing the different speakers on different questions. My first guest is Ms. Rangari Morai, the coordinator of the Food Safety and Food Standards Committee. I think part of the important part of food fortification is the country's standards. There is global standards, there is the SADC region standards, and it would be really interesting to hear someone tell us about these standards. The specific question is, what is the legal and policy framework for the food fortification in Zimbabwe? Over to you, and thank you so much.
That it encourages people to grow and store adequate food. Over and above that, there has to be secure and establishment of adequate food reserves. And lastly, the state is also supposed to encourage and promote adequate and proper nutrition through mass education and other appropriate means that will ensure that each and every person in Zimbabwe is nutrition secure. So I think this sets the tone for coming up with whatever legislation is there to make sure that we support nutrition security. And then from there, Section 77 of the Constitution of Zimbabwe talks of the rights to food and water. And I would like to zero down on issues to do with sufficient food, which are mentioned in Section 77. It states that every person has the right to sufficient food. And it is the responsibility of the state to make sure that they make reasonable legislation and other measures within excuse me, let me just remove my spectacles. It is the responsibility of the states of the state to take reasonable legislative and other measures within its limits and resources to achieve the progressive realization of this right. So basically what the Constitution says is every person has a right to food, but the state must protect everybody in terms of coming up with means and ways of making sure that everyone has access to this food, and it has to be nutritious food. So I think we derive our food fortification drive from the confines of this Constitution of Zimbabwe. From there, I think as one of the previous speakers talked about, our food fortification in Zimbabwe was driven or came into being with the promulgation of the Food and Food Standards, Food Fortification Regulations, SI 120 of 2016, which seeks to ensure that no person should manufacture, import, pack, or sell any wheat flour, milled maize products, sugar, salt, and edible oil, unless such products is fortified. So this piece of legislation was put into play in 2016 to make sure that 5 of our products, to start with, are mandatorily fortified. And this is salt, edible oil, flour, sugar, and wheat flour. So that's the legislation that we are still using, or the SI we are still using to date, to make sure that whoever is manufacturing those 5 products or whoever is selling those 5 products should ensure that the products are fortified. So in as far as the legislation in Zimbabwe, those are the pieces or the instruments that we have to make sure that there is mandatory fortification. And to start with mandatory fortification of those 5 products. And then over and above that, there is commitment from the government to make sure that food fortification is also taken on board as a way of addressing malnutrition or nutrition deficiencies. And to start with, there are, like somebody said again, one of the previous speakers, in the NDS 1, there's provision and there is specific mention of the fact that we need to upscale food fortification and in particular biofortification. So there's strong commitment from one of our strategies, the NDS 1, to make sure that as Zimbabwe, we upscale issues to do with fortification in addressing nutrition insecurity or in addressing micro deficiencies. So from the NDS 1, we also have the Food and Nutrition Security Policy, whose goal is to promote and ensure adequate food and nutrition security for all the people in Zimbabwe, particularly amongst the most vulnerable, in line with our cultural norms and values and the concept of rebuilding and maintaining family dignity. So this policy just seeks and commits government to a program of spearheading comprehensive and cohesive multi-sector response to ensure food and nutrition security for all the people. And this is including the fortification we're talking about. So within the food and nutrition security policy, we have got 7 commitments, but among those commitments, we have 3 specific commitments that speak to nutrition security and also to fortification in particular. And I will just single out those commitments for our information. I'll first talk about commitment 1, which talks about the fact that the government of Zimbabwe is committed to ensuring policy instruments which protect and enhance food and nutrition security, particularly amongst the most vulnerable. So it is the mandate of government, like it is spelled out in the Constitution and is also now singled out in the policy, in the food and nutrition security policy. Government has to come up with sound policies has to come up with strategies that ensure that there is nutrition security. So that's about commitment 1 of the food and nutrition security policy. And then we also have got commitment 2, which talks about the government of Zimbabwe should ensure food security for all, including access to adequate, diverse, and nutritious food by all people at all times. So besides people accessing food, we are saying the food has to be nutritious, the food has to be safe, it has to be of the right quality in order to support and to make sure that we drive nutrition insecurity. So commitment 2 talks to that, where the government of Zimbabwe has committed itself that they have to make sure that there is nutritious food over and above food security for all the people. And then commitment 4 in the policy also talks about the provision of safe and wholesome food to all. So basically we're saying all the food that is manufactured locally and food that is imported into the country has to meet the national and international standards in terms of quality and safety. And that's fortification included. And then from commitment 4, the last commitment that talks specifically to issues to do with fortification is commitment 5, where the government is also committing itself to ensuring nutrition security for all through the implementation of evidence-based nutrition interventions that are integrated within a broad public health framework, including health services as well as water and sanitation. So through commitment 5, there's also the commitment by government to make sure that everyone in Zimbabwe has got access to nutrition services and also access to nutritious food. And this has to be done including issues to do with the health services as well as supporting issues to do with water and sanitation, as they are directly related to nutrition. So that's all about the food and nutrition security policy. And then another policy that I'll talk about is the National Agricultural Policy Framework 2019 to 2030. This policy also has issues to do with food fortification, where the Ministry of Agriculture and its partners have a real drive to facilitate implementation of policies that promote crop diversity and availability of nutritious food from own production and local markets, specifically to promote access to bio-fortified seed as well as ensuring that there is bio-fortified food in the country. So this policy framework was crafted with issues to do with fortification in mind, where we're saying, let's promote biofortification as a means of fortification to ensure that we drive away nutrition insecurity in the country. So within this policy, again, there is commitment to support development and enforcement of micronutrient interventions and all the other related policies. So this is from the agricultural point of view, where we're saying, let's factor in biofortification to make sure that we drive nutrition insecurity. And then those are the policies that we have. Over and above that, we still have some policies which are in the making. Some are almost complete. I'll talk about two, not policies, strategies rather. I'll talk about two which are on the table at the moment. We've got the food and nutrition security strategy. The strategy seeks to put into operation government commitments, which I talked about, which are in the food and nutrition security policy. So within this strategy also, we've got implementation plans specific to sector ministries, which they commit themselves to make sure that nutrition security is ensured. And one thing that comes also into play, or one thing that is loud in the policy, in the strategy rather, is issues to do with biofortification, home fortification, as well as industrial fortification. And then lastly, I'll talk about the food fortification strategy, which is almost complete. The strategy talks about 3 interventions which we would like to promote as Zimbabwe: industrial fortification, biofortification, as well as home fortification. I recognize that I do not have more time, but let me just make a comment lastly. The issues to do with legislation have to be supported by proper monitoring mechanisms as well as enforcement. So this is one thing maybe as a country we need to strengthen. This is one thing that we need to work on, so as whatever legislation we put in place or whatever strategies that we put in place, whatever policies that we come up with, let's put in viable monitoring mechanisms as well as enforcement mechanisms to make sure that every player within the fortification drive is playing their part. Thank you.
Can you hear me? Yeah, thank you so very much for this extensive and assuring session that actually safety of food, consumption of nutritious food is part and parcels of all different legislations, levels, and policies in Zimbabwe. We remain to recognize that, yes, the policy is there, but there is quite a need for monitoring, evaluation, and enforcement. Thank you so much. My second guest is Anna Maria de Boer. She's the industry representative from Nestle. And I think this is an online connection. So I'm not sure how are we going to be able to facilitate this one. So hello.
Good morning.
Good morning, Anna Maria. Thank you so very much. My name is Safinaz Ahmed, and I'm moderating this session. If you can hear me well, maybe I can go ahead and have the question for your part of the discussion.
Please go ahead. I can hear you very well.
Thank you very much. As a representative of the industry, and not a simple one, a big one, Nestle is big, we all know that. We have 3 questions that if you can answer them, unpack them, that would be quite useful. The first question is, what are you / Nestle is doing as a private sector in addressing malnutrition challenges in the country, Zimbabwe, and elsewhere in the world? And that is Nestle commitment to reduction of malnutrition in Zimbabwe or elsewhere. The second question is, what had other countries been doing that Zimbabwe can learn from? Nestle is a multinational. You guys are working all over the world. So I'm sure you have lesson learned from experiences in other similar kind of economy country like Zimbabwe that you can share with us, and if you do, we will be very grateful. The third and last question is, in your opinion, what can be done in Zimbabwe to bring all players into the table? as we speak about fortification, as we speak about the involvement of the private sector, from your experiences, what is it that we can best do to get everyone into the table? Thank you very much. Over to you.
Good, thank you very much, and thank you very much for the invitation. I hope the audience can hear me well, and hopefully see my screen as well. I'm going to answer this question really through a few slides that I would like to share with you, and I hope to answer most of your questions that way. So if we look at micronutrient fortification, I think the first thing, and it really addresses almost question 3, is to understand that we believe we've got a common goal, and that is that we need to end malnutrition in all its forms. We know currently worldwide we have more than 2 billion people that's actually lacking micronutrients like iron and vitamin A, more than 155 million children globally that are stunted. So we really sit with this double burden of disease that I think one of the previous speakers also referred to. Then we had the World Health Organization with a global target of reducing anemia by 50% in 3 years' time, 4 years' time. And I'm not so sure that we're going to meet that objective. And from the Sustainable Development Goals, we know that we want to end all forms of malnutrition in the next 9 years. So if you think about it, we have a huge task at hand. And I really do believe in order to address this, we need to work all together. And it cannot be in silos, but that we all work together to address this. One of the things that I think we also need to perhaps just consider is who's the most vulnerable populations for micronutrient deficiencies. And I think to a large degree, we all agree pregnant women, children and infants and children are probably the most vulnerable, but I think we forget about another group or groups of people, and one is the adolescents. They seem to have fallen off the radar screen, and then of course adults, if we think about men, and then of course very importantly the elderly, because as much as Africa is a very young population, it's also a population that is growing older. And we can see that the life expectancy is actually increasing in all the countries in Africa. So I think we really have to consider everybody, not just a few people. So how can we do this? We also know that WHO released this report or the guidelines on micronutrient fortification. But very importantly is we need to consider the diet variety or diversity in the diet. And one of the previous speakers also mentioned that as a rule in Africa, our people have very monotonous diets, often because of a lack of funding, but also because of a lack of knowledge. Then, of course, we can supplement, and I think in many of our countries, as well as in Zimbabwe, we do supplementation. Then fortification, which I think is what we're talking about today, and one of the previous exhibitors spoke about biofortification, which is also quite an important role and an important consideration for us to keep in mind. Now, if we look at this, if we look at the aim, which is for us from a Nestle point of view, is really looking at prevention. And I know you can't really see the slide there, but I mean, from a supplementation point of view, it's normally for severe deficiencies. It's normally within a medical treatment framework that we do this, and it's very targeted. So, and there are very specific products for that. But from a prevention point of view, there's a lot that we can do. So from a food fortification point of view, we don't need to change dietary habits. And I think Zimbabwe has gone a far way already with your fortification policy, with staples. I think your sugar is also fortified. We also know that it's very cost effective, and we can focus on the big 4 nutrients, which I'll share with you just now. And then, of course, really look at ways in which we as an industry can provide affordable food. I think it's important to understand people still buy food even with the little that they have. And what we would like to do, and our previous speaker from the Nestle exhibition mentioned our goal is really to to open up the food and really making sure that people understand what's the power of food and making it available to more people. Then, of course, diet diversity is very important, and how can we increase the diversity in food intake and make sure that foods are naturally rich in nutrients. And this is really where I also think the biofortification plays a key role. If we then look at how does this all work, we can see that mass fortification, this is normally a mandatory thing. This is what we've seen with food fortification regulations. From a voluntary point of view, we can have market-driven fortification, which we have, and I'll share some of the examples with you just now. And then, of course, targeted fortification. So everybody can actually play a role in ensuring that we address at least the hidden hunger on the continent as well as in Zimbabwe. We focus primarily on the big four, which we call the big four, but it's iron, iodine, zinc, and vitamin A. Zinc is one of the ones that I think to a large extent has not been fully addressed. I think vitamin A, we're doing well. We're improving quite a bit on that. Iodine, we've done exceptionally well on the continent with really reducing iodine deficiency, but iron deficiency, of course, still a big problem. And perhaps just some of the health implications is to understand that iron deficiency accounts for almost 20% of all maternal deaths. And then we've mentioned the reduced cognitive and motor development in children. And the problem with that is that we by not addressing this, the human capital of children is not fully developed. And as a country, we then lose quite a bit of money because the GDP reduces, the ability to earn a higher income is affected, and the ability to be participants in an economy becomes also reduced. Of course, the vitamin A we know a lot about, and then zinc deficiency, around 17.3% of the world's population. I can just mention to you that in South Africa, almost 45% of children under 5 in South Africa does not have enough zinc. I think if I were to guess, that would be the levels also in Zimbabwe and really in Southern Africa. Because we really see this as something that affects our countries quite big. We know that fortification improves outcomes, and here you can see what's happened in 1961, and you can just look at the colors. You don't have to see this, but this is Africa, and we can see through fortification how this has improved. And here you can see a very similar thing in 1986 versus 2011. So we've definitely made some very nice inroads into addressing the micronutrient deficiencies. So our approach to this is really to look at the landscape, what is happening there. It's important to choose a relevant food vector. Not all foods work equally well when we fortify it. Also important to look at who's our consumers. What can they afford? And then also, very importantly, is to strongly communicate the benefits. This is one of the areas where I think we lack as countries, that our people really just don't know. And then, of course, we need to maximize the product availability. Importantly for us is really to collaborate and work with partners. And I think, Zafina, when you said what can be done, this is probably the one area where I really believe that this meeting that we have today and similar meetings and similar collaborations are extremely important. And then very importantly, and one of the previous speakers mentioned this, is we have to demonstrate impact. If we cannot show the impact, it becomes very difficult. I'm going to share with you just a short example of how we do this. We understand the local deficiencies, then we look at what is the best food vehicle for that. Then we communicate and educate our consumers around this. And very importantly, we make sure that it's also then available in a format that our consumers can afford. Of course, we then work with partners. And very importantly, we then look at the efficacy of this, the effectiveness, how far do we get, and actually does it have a public health impact? But before we get to that, perhaps the one thing that we need to consider is what are the challenges that we need to meet for it to be successful. And I think from a food industry point of view, this is really critical. We need to look at the texture of the food. If it's going to change the texture of the food to such an extent that the consumer won't eat it, it doesn't help we go ahead. The cost, of course, we've mentioned is very important. What is the handling and processability of that particular food or the nutrients that we add? How does it function within the supply chain? And very importantly, similar to the taste, is how does it act, similar to the texture, how does it affect the taste? We know certain formats of iron, by example, will color the food in such a way that people won't eat it. If we give a certain type of iron or iodine, it actually changes the taste of the product and people won't eat it. So very important that we look at those. Also the consumer acceptance, making sure the consumers want it. It doesn't help we just fortify for the sake of fortifying and consumers won't use the product. And then of course the health and nutritional value of that product as well as the food safety and quality, we cannot compromise on at all. So these are very important elements to consider when we then look at fortification from an industry point of view. Then I think just something else to share with you, what have we done? I think that was your previous question. Globally, in 2019, we have provided just over 185,000 billion fortified servings of food in different formats, milk, noodles, all sorts of cereals, all sorts of formats. And this slide just quickly give you a quick breakdown of this. This was for Africa. Primarily within our food, that's the noodles and the bouillon cubes. Of course, dairy, the milk, the cereals I've mentioned. Of course, infant nutrition is also fortified, but we even have some confectionery that is fortified. And we're now actually embarking on getting the beverages, so the coffees and the teas actually fortified as well. And then my last slide, I really just want to leave this thought with you, is that without an adequate supply of micronutrients, not only are we less likely to sleep deeply, recover briskly from exercise, ward off sickness, and fully exploit our brain power, we actually get hungry and we stay hungry. And I think this is also where the hidden hunger is coming from. So to the chair, I hope I have answered your questions. I didn't get into, well, I don't have time for the example, but we are happy to share with you some examples of what we've done in other countries to actually measure the impact. India is one of the countries where we were able to actually measure significant impact when we started fortifying cereal there. So with that, I don't know if there are any questions.
Thank you so very much. I think you've explained to all of us very well how Nestle take fortification seriously and how, in that sense, they kind of like a force in tackling malnutrition. I think, and because of the time, and as you have suggested, it would be really helpful if you share with us country experiences that Zimbabwe can benefit from. So I think, I don't know how we do that, maybe through emails that we can exchange later on, or with SIBO, the Food and Nutrition Council, they can get in touch and we can have those documentations if you have them.
Happy to do that.
Thank you so very much. Thank you. Now, my guest is the representative of the Small and Medium Miller Association, Mr. Alois, who is the administrator. There's a couple of questions, actually 4 questions, that we have for Mr. Alois. The first one is, how are the millers taking advantage of fortification drive in the country and beyond? That is again, how are millers taking advantage of fortification drive in the country and beyond? The second question is, what has been your experience in the fortification drive? The third one is, what are the challenges you have been facing? The fourth and last question is, do you have any recommendations to improve food fortifications in Zimbabwe? Thank you, Mr. Ruiz, and over to you.
Okay, thank you. Right, once again, my name is Alois Sengwe, and I'm the administrator of the Small to Medium Millers Association of Zimbabwe, an association of millers who are producing whose capacities of production is 1 metric ton up to 15 metric tons of production per hour. That's the grouping for Small to Medium Millers Association of Zimbabwe. Right. You've given me 4 questions, yes, but I will simply make my presentation. I think what I will talk about here will also simply answer the questions as they are. Okay, right. I think our role as the Small to Medium Millers Association of Zimbabwe in this fortification exercise or initiative or program is to basically produce mainly maize meal, produce wheat flour that is adequately fortified and distributed to the market where the target population is. And we hope that in so doing, we are being a partner, we are assisting the nation in achieving its objectives, its aims in making sure that whatever is set out to be achieved with this program is achieved. We also assist the government in the advocacy and awareness campaigns to encourage the uptake of fortified foods, including the maize meal and wheat flour. We also, as an association, we are also seriously or profoundly encouraging our members to follow the government guidelines, policies or regulations, legislation on food fortification so that, like I said before, the objectives, the aims and goals are achieved of fortification. That is from the level from the viewpoint of the association. We have many members in Zimbabwe. We're a grouping of, at the moment, 61 small to medium millers in Zimbabwe. And we are in every province. And we believe that our composition and where we are situated, located across Zimbabwe, in Zimbabwe, allows us or gives us an opportunity to play a very important role in the distribution of fortified maize meal and wheat flour. Though in terms of wheat flour, I think at the moment we only have 2 members who are into wheat milling. But maize meal, we are all over Zimbabwe in every province. Right. I think from our encouragement, our engagement with our members on this program, and in our attendance of some of the programs that have been hosted by the government, the Ministry of Health, the major feedback that we have received from our members is that, yes, fortification has got very huge benefits for Zimbabwe, to the children, to the women, but it also comes with a cost. Now, the talk that has been there is that the cost, when they look at how much maybe micronutrients have to be put into every ton of maize meal, every ton of wheat flour, the word that has been used there is that now the cost is negligible versus the advantages. Yes, we agree with that, our members agree with that, but then a cost is a cost and then somebody has to bear it. And the major question has been, who is supposed to bear the cost of that extra $6 per ton, extra whatever? Because our members are in business, yes, they have so many more overheads. For us to pass on this cost to the consumers, now Mrs. Mpofu here and the others will be on us that we are being unfair to the consumers. So there, I think it's an issue that the government has to also seriously look into and ensure that this cost is borne maybe by government, or maybe we share that cost so that at the end of the day, the target population that is supposed to get this, these fortified foods, get them. Like Ms. DBS was saying, the issue of affordability, because we may fortify the food, and at the end of the day, people don't take it, don't eat it because it's expensive. Then we are not doing anything. Now, the cost of micronutrients, yes, and then the cost of the fortifying equipment is something that that has also been raised, that we would want, but we would request the government that maybe this equipment, when it comes into the country, when we import it, it has to be jute-free, and at times we would also request that funds are made available, foreign currency is made available to the millers to acquire this equipment. And also suggestions have been made that is it not possible also, maybe not now, but in the long run, that these micronutrients may be produced locally, that the equipment may be produced locally. Yes, we are creating employment for our people. We would appreciate very much if we are to have these available locally. Then there is also the issue of communication, this advocacy and awareness. I know we have had these strategies that have been, that the task forces they've come up with. Now, communication and awareness is something that is very seriously lacking. And the fear that is there from the small to medium millers is that if we are to, like, this fortification is now mandatory, we are producing our maize meal, we are producing our wheat flour, and then we distribute it. It's there in the retail shops, and then it's fortified. People don't know about fortification. They would read the packaging, see this logo with Zimbabwe there, and then so many things, just like the COVID vaccination. People would shun our products if they are not conscientized, if they are not made aware of what fortification is. Just like from the presentation that was made by Dr. Leslie, that there was a study that was done on 25,000 households, and only 3,000 and something households knew about fortification, and it came to about 12%. Now, for business, if you have produced your product and then the market is not receptive, then it becomes a huge cost to business. So our appeal, we know as Small to Medium Millers Association, we also have to take a part in the awareness campaigns, advertising, etc. But we strongly believe that central government and Ministry of Information, Ministry of Health have to take a leading role in making the population aware of what fortification is. And it's not only the population as in the consumers, but we also would want the government to ensure that all its employees, its directors, everybody is aware of what fortification is. Because if we are to go to the RBZ, to the auction floors, and we are saying we want to bring in micronutrients, if the people there, the RBZ, do not know about what micronutrients are, what fortification is, then we may not be prioritized for that week in the allocation of foreign currency. You go to the Ministry of Finance, you talk about fortification, you want to import these things, and then they don't know about it. So it becomes a challenge. We have had the meetings on fortification that we have been having. I think I've seen people from the Ministry of Agriculture, Ministry of Industry and Commerce, but other Ministry of Health, yes, of course, but from other departments, other ministries, that may be relevant to this initiative, we have not been seeing them. Even the Ministry of Small to Medium Enterprises has not been coming because it's also one of our parent ministries. I think those are the major challenges that we have been seeing. And also, I think the government, when it is implementing a program of this nature, it also has to consult industry to look at how the market is playing out at different times. Just like now, the milling industry, I think I have colleagues here from the milling industry who will tell you that there is very, very low uptake of maize meal from the factory at the moment because, though ironic, there's so much maize in Zimbabwe. People are not buying from the shop. People are simply taking their buckets and going to the service mill in the community. If we produce in the factory fortified food, fortified maize meal, it may expire. The shelf life, it may expire while we are still holding on to it. It may never get to the target population. There's also need maybe to incentivize the population to take up this fortified food ahead of their amazement from the service milling. We don't want to take business away from them, but what we are simply saying is that maybe strategies have to be found to ensure that what is fortified has to be reached to the target market. Or in times like this, we would think that home fortification can also assist, ensure that the service millers are also made aware about food fortification, distribute the sachets to them or micronutrients, make people fortify at home if we are to achieve our goals with fortification. Because at the moment, even if Dr. Leslie would want to make another study in here and say, when did you last buy from the shop maize meal? Most of the people in here, they will tell you. And then people are simply taking their buckets to the service mill. So in that regard, we would want to request the government to ensure that they look at the market, how the market is playing out at any particular given time with regards to the fortification program. Then, lastly, maybe, I think there is also the issue of, like Ms. Marairo talked about it also, about monitoring and enforcement. Now, this has been made, fortification has been made mandatory. Now, we are players in the industry, and the moment that whoever is responsible for enforcing food fortification to ensure that you have your micronutrients in your maize meal, in your flour, if you don't enforce it, somebody incurs an extra cost, buys micronutrients, follows the rules, the guidelines, and somebody simply mills and maybe simply takes up the logo and puts it on the packaging and says fortified. Now that creates a very unlevel playing field in the industry, because somebody is incurring, one miller is incurring an extra cost, one is simply maybe playing around with knowing that there's no enforcement at all, and then that creates a very unlevel playing field. We would want to recommend that the issue of monitoring and enforcement of this be strongly or maybe adhered to, enforced, so that we don't have people who are saying the field is very unlevel. Because $6 per ton, when you look at it, for industry, that is a lot of money if you are pushing volumes. I think, I don't know if I've managed to answer most of the questions. I think that's my presentation.
Mr. Alois, you've given us a good understanding, or at least a glance into the medium-sized small businesses that are into fortification in Zimbabwe, the size of it. We'll have a question later on when we have when we have a Q&A session. You've summarized the problems that the sector's facing as the not quite out of competitive business, in the sense that is not supported, and if there is a way, government should maybe tax exempt the equipment for fortification. And then there is also the issue of yes, you can produce the fortified food, but if on the demand side people don't want it, then as a business you are failing. And you've given a good example that you have the maize or on the shelves and it expires simply. This is together with what have been mentioned earlier on as the monitoring and evaluation and enforcement. So thank you so very much. And with this, I move to our last guest, and that is Ms. Rose Info. She is the representative and the acting director of the Consumer Council of Zimbabwe. I think as just put a note to say that I don't think, we cannot emphasize enough that the role is not just for the private sector, the role is not just for the public sector, the role is for all sectors, for all players in this field, is that we come together, we work together, we address these challenges so that we make it a win-win situations for everybody. Malnutrition is quite devious. It is not just about a child that is just thin, but the stories and the narrative has just been established such that if we don't tackle malnutrition early enough, society loses a great deal in terms of brain development, education attainment, later on in life, earnings and employment. So this has been established, and I think that is what makes the importance of trying to tackle nutrition is. The specific questions that I have for Ms. Rose is two questions. The first one, as the Consumer Council, what are the consumer perspective around food fortification? The second question is, any comment on the consumer awareness around food fortification? And do you have any recommendations for the various players that are here in this room so that, as I said, we all together make fortification a win-win for everyone? Over to you, Ms. Rose. Thank you.
Thank you very much. Thank you for the introduction. My name is Commissioner Rose Mpofu. I'm a commissioner with the Consumer Protection Commission. I will speak on behalf of the consumers. Thank you for that opportunity. Let me begin by saying that the control of micronutrient deficiencies is an essential part of the overall effort to fight hunger and malnutrition, thus upholding one of the consumer rights. I think when Ranga, my colleague from Food and Nutrition Council, started, she started by highlighting on the relevant pieces of legislation that uphold this fact. She began by talking about the national constitution, went on even to talk about the various pieces of other legislations in place, and particularly the legislation on food fortification. This supports one of the government's favorite sayings of not leaving anyone behind. And the Consumer Protection Act has also clearly supported the statement on not leaving anyone behind. Why I'm talking about this is, never mind all the efforts that government will make, that industry players will make to try and ensure that food is fortified. If the consumer is not well educated, well informed, well aware of the importance of food fortification, of the importance of consuming and taking up the nutrients through those food vehicles that have been fortified, all our waste, I'm sorry, will go to waste. We need to ensure that the right of the consumer to information and education is very much upheld. Consumers need clear information, honest information. Packaging and labeling regulations should be very clear, and information on the on packages should be honest and readable. Sometimes you can't read it if it's in small print. Sometimes the language might not be clear, so it has to be in a language that is understood by the majority of the population. The other rights that consumers have are the right to choose, the right to safety. I think Anna Maria also spoke about standards and safety. That is very clear, and consumers need to be confident that whatever they are consuming is safe for their health. Consumers have a right to representation. So you find that at all the various levels of policy making, we need to have consumers represented at that level. So consumer health, environment, consumer rights to redress, all these are very important. So there are also other issues you would like to think about, other consumer issues, such as consumer taste, the color, ease of use, the texture, and I think Anna Maria also highlighted even on the smell. And in Zimbabwe, the issue of price will remain very key. So it is something that is to be considered when we are talking about fortification. And Alois Sengwe just highlighted on some of their challenges as SMEs to say, how do you produce without incurring too much cost, which will eventually impact on the consumer. So all those issues are very important. Some of the advantages of food fortification to consumers are obviously that you can fortify and without too much behavior change, people can be sort of forced to eat what we have fortified. But again, we are saying let's not leave anyone behind. Let's educate, let's make people aware. It is very important to take into account the concerns that consumers have, because malnutrition is a reality in our country. It is very rampant. I'm not sure what the next micronutrient survey will reveal, but certainly it is real. It's a big problem, and when they say it's hidden hunger, it is not a joke. You see people who are obese, and naturally we think they're healthy or they are eating well, and yet the opposite is most likely to be true. So it's important that we address issues such as the slow uptake of fortification by industry. Consumers are very worried that industry is taking their time to fortify. Even though it is low, we need those challenges, those problems to be addressed on time so that the fortification program can be rolled out as quickly as possible if our challenges on malnutrition will be addressed. We can no longer afford to lose one more life because of malnutrition. Because this young girl has lacked in iron, therefore she dies. Just a few months ago, we witnessed a young girl who died because she was anemic. We can no longer afford to lose lives when we know very well the challenges. Let's address those challenges. The other concerns that consumers have are those to do with the incapacitation of small-scale industries. Our SMEs, for example, the hammer millers, because most consumers are growing their own grains. For example, maize meal, the maize that they are growing and taking to the small hammer millers to get their mealie meal. That mealie meal is not fortified. So we need the small players to be capacitated as soon as possible, because the majority of our population are consuming homegrown maize. And if the small millers are not capacitated to fortify, what that means is all our efforts to fortify maize meal are going to waste, because only a few households in the country are buying maize meal from the supermarkets, from the big industries. We also have to take into account things such as the time, the time it takes for people to access those hammer millers. Are they able to get their service on time? We want to also look at the low capacity for consumer education by all consumer movement at large, but not only the consumer movement. The Consumer Protection Act is now talking about suppliers also playing a part in consumer education. So you would like to think and say, what is industry doing in terms of consumer education? Because the consumer movement will not be experts in all areas of expertise or technical expertise. So we need industry players to partner with consumer organizations to educate the consumer, particularly on food fortification. We also are concerned about the very low marketing of healthy foods. For example, the small grains. And I think at some point, Alois did mention that sometimes it's a challenge if you try and sell small, healthy grains. People might not, be attracted to those. But again, it's all centered on consumer education. Are people educated to know the health benefits of consuming such small grains? Last but not least, we need independent verification by the consumers themselves to verify whether what is labeled or what is being said to be fortified is indeed fortified. We've seen other countries do that. For example, in Uganda, they do have consumer-owned laboratories where verification tests can be done independently, not by the suppliers themselves. So that is another key element. And as consumers, we are saying we are concerned about that, and we would want those independent verifications through various laboratory tests to testify, and grow the confidence of consumers. So in a nutshell, we are saying as consumers, we cannot just sit and expect that this problem of malnutrition goes if action is not taken in a speedy manner. So as recommendations, we are saying, please scale up the fortification program. serious enforcement of the regulations needs to happen. People need to know that this is the law. Industry needs to know it is the law. It's not a choice. They need to fortify. Another recommendation is that we need to capacitate the small businesses. The big brothers, for example, can partner the smaller ones in their corporate social responsibility efforts. And the third recommendation is that on the marketing and promotion of healthy foods. We need the foods to be marketed the same way all other, foods are being marketed. The same way we are marketing junk food. Use that same way to market the healthy foods, the small grains. And then, of course, the verifiability, consumer verification, consumer-run laboratory tests in order to grow consumer confidence, such as what other countries are doing. The issue to do with consumer awareness and education being one of the most key issues, we are saying consumers should be educated, they should be made aware of the advantages of fortification. They need clear information, they need to be aware. Consumers are eagerly waiting for the full, fortification program to be implemented, where all millers of identified food vehicles can fortify at reasonable prices, taking into account consumer issues such as taste, texture, color, price, among others. Consumers should be taken on board at every level of fortification. No one should be left behind. An educated consumer is an empowered consumer. If consumers are taken on board and they are educated, empowered, given all the necessary information, they will immediately support the fortification program and hence address the issues, the fears of the small millers. Let me end by talking about the opportunities that are there from the consumer movement. At Consumer Council of Zimbabwe, we have a full consumer education program that is awaiting partnerships with various players from the industry. So I would like to encourage industry to partner with Consumer Council of Zimbabwe in educating the consumers on food fortification. There are also fortified food fairs that are going to be carried out beginning 2022. And once again, we appeal for partnerships. Healthy food exhibitions at Consumer Council of Zimbabwe, again, partnerships. And the last one is the media education partnerships. And also, if COVID allows us, we can even have the physical outreach programs. Thank you.
Thank you so very much. This is bring us to the last of our guests. We've already something like 15 minutes or even more behind time, but we still would like to have maybe a couple of questions, one or two, not more than that, from the audience to the participant. Sure, please. So we have three, the gentleman there, Yusuf, and the lady there. You've been having your hand? Okay. So three, okay. Please be precise. Please, we're really running out of time. be precise and short. Over.
Thank you so much. Thank you so much, madam. My name is Gordon Chiponda from the National Bakers Association of Zimbabwe. And my question is directed to Anna. It's on the legislation concerning imported food. Any one of the vehicles that are used.
Can you raise your voice a little bit? I don't seem to be listening, hearing your voice.
Okay. My name is Gordon Chiponda from the National Bakers Association of Zimbabwe. And my question is directed on Anna, and it's on legislation on imported products, which we are using as food vehicles. Like flour, we import flour, which we use as bakers, and the sugar is also imported at times. Is there any, I seem not to have heard any legislation that controls the importation of, say, flour that is fortified, as well as sugar as well that is fortified, and if there are controls, what controls are there to ensure that the flour that is fortified is also, so the flour that is imported is also fortified. Hello, I'll come again. I said my name is Gordon Chiponda from the National Bakers Association. I'm concerned on the imported flour, and my question is directed to Anna. And I'm saying I seem not to have heard if there's any legislation that is on imported flour or imported sugar that we use in baking to ensure that the imported flour is also fortified. Thank you so much.
You're welcome. Maybe we take the three questions together and then give our speakers a chance to respond.
Thank you so much. I am Tafadzwa Jagachira from Clopis Investments. Actually, mine is not a question, but it's a contribution to and a recommendation directed to Mr. Alois. Actually, I want to say that when I agree with what you were saying about the challenges being faced by manufacturers, but I want to say that when you're presenting the challenges being faced, when you come up with measures to address those challenges, may you also include other manufacturers that are outside the 5 categories that you have highlighted, that are also fortifying, so that when, let's say, there are privileges that have come out, those other processors can also be included.
Okay. Thank you. The last question goes to the gentleman here.
Okay. Okay, thank you very much, ma'am. My name is Tinashe Mbiriri from Skybrands Africa. And my question is, are there strategies in place to supporting nutrition-sensitive private sectors where companies actually are healthy food-producing companies? Are there strategies to support them, like incentivize them, in the mantra to push the Food Fortification Act?
Thank you very much. I think we give the mic to our guest speakers.
Just put it on this one. Okay, thank you.
Also, just like I've appealed to the questions, the answers, I'll appreciate if they are also very short and precise. Over.
Okay, thank you for the questions. I'll respond to the first question from Mr. Chiponda. The SI 120 of 2016 I was alluding to, if you read on section 4, it talks about all foods that are imported or locally manufactured are supposed to abide by the legislation. So there is, yes, the legislation which talks about those foods. When you import your food, make sure that it abides to the legislation. Or if you import it and it's not fortified, then make sure that you further make sure that the product is fortified before you release it to the market. I hope I've answered you. Because the piece of legislation contains both locally manufactured and imported. I think I'll answer that. The question from Tinashe, I'm not so sure if I'm supposed to be answering it on strategy, if there are any strategies which are available to incentivize the small industries. At the moment, I don't think so, but maybe it's an issue that can be, the players can push with government, but I'm not aware of any. Thank you.
So that's it about the questions. Thank you again for our guests. And over to you, Raymond. Thank you so very much.
Let's give another round of applause to Safinas for moderating this very useful discussion. And we want to thank our panelists for all the key issues that you have raised, especially the issues that were emphasized by the Grain Millers Association or the Small Millers Association. We know that the concerns have been heard and action will be taken by the appropriate stakeholders. And I think it's an opportunity for all of us to learn of how we can keep on supporting each other as a SAN movement. So yeah, without further ado, I want to thank all of our presenters. We're a bit behind time, but I think we managed to achieve all that we had wanted for today. So I'll give this opportunity to our SAN convener representative, Tatenda, to give us some closing remarks and maybe some final words before we then tour our stands so the exhibitors can be ready to have people come through and maybe you explain further at your stands. So I call upon Tatenda before we then close and tour the stands. Thank you.
Good afternoon. What a pleasant day we've had today. My task is very simple and very easy. Just 2 words to say thank you to everyone for your attendance. Thank you to everyone who was involved in the organization. Thank you to all those that have managed to come and attend. Thank you for the deliberations. Our exhibitors would like to thank you for the time that we've had together. We hope that we'll continue engaging, we'll continue networking. Let's take the time that we have. I think we're going to have our lunch. Let's take the time that we have during our lunch to exchange numbers, to exchange contacts, so that we continue working together.
Unless if you want me to.
So just to say,
Maybe just to announce one or two.
everyone that was organizing, thank you very much and have a pleasant afternoon. Thank you.